Today on Global Health Frontiers.
Combien petit? Combien?
One of the biggest parts of our jobs as Cuban doctors is to identify with these patients. They're not just numbers to us, they are human beings.
At the age of 44, I got stage 4 throat cancer.
This is really about preventing people from dying from tobacco use.
You know, in India, no one really believed calling for an ambulance when someone was alive. People only called for an ambulance when someone was dead.
If a person don't get quick emergency care in a medical emergency, it's effectively equal to no medical care.
It is a defining challenge of our time. Bringing modern medicine to hundreds of millions suffering from preventable and treatable diseases and conditions of poverty. Eliminating infections in many areas and tracking the sources of deadly global pandemics. With new advances in resources, science, and skills, pioneers on the frontiers of global health offer hope for healthy, productive lives. These are their stories.
Global Health Frontiers is made possible by support from the John Moores family.
Despite billions of dollars in real and promised disaster relief, Haiti seems like a country in constant need. The poorest in the Western Hemisphere and one of the poorest in the world.
This is a pig, so it's lived the same way with the people, so it's not good because the people, we're not animal. So I don't like this life in Haiti.
Repeated hurricanes and a devastating earthquake have claimed hundreds of thousands of dead and injured, deepening bleak conditions of poverty and unsanitary living conditions that cause disease and misery.
This one has diarrhea, that one has diarrhea. It's so bad that it causes the kind of fever that just completely crushes them.
The critical years for a child to be infected is between 6 months and 4 years. That's when the child starts to get to the floor and to start to put everything in his mouth. This is how the children get the cholera and all those infectious diseases.
Sitting only 90 miles from the coast of Cuba, Haiti's long-suffering people have been receiving critical health care from their neighbor to the west for nearly 2 decades, and their desperate need for medical assistance continues.
We can go?
En estos momentos nos dirigimos a realizar un control de foco.
We are on our way to an area where a boy diagnosed of cholera has been found, and we are heading over there now to carry out an active research.
Este realmente es un sitio de difícil acceso.
This is a difficult area to reach, as you can see, and we're also going to check in other areas for possible cases of people with diarrhea and provide treatment.
Combien minutes? Combien minutes? Oui. La pregunta, ¿qué sucede? Que a nosotros nos forman, o sea...
Cholera hasn't left. Realistically, cholera is now endemic here in Haiti. It behaves in seasonal cycles and is very much tied to the rainy seasons.
La Brigada Médica Cubana llega a Haití.
The Cuban Medical Brigade arrived here in Haiti for the first time year 1998 after Hurricane George devastated this country.
O sea, en buscar el paciente, vamos en busca...
All right, now we're here. You know what activities we have to carry out. Find more patients, look for more cases of diarrhea. Yes?
¿Cómo lo lleva, papá? ¿Qué le ayuda? Dos cosas fundamentales.
There are two main reasons that differentiate Cuban doctors from perhaps other doctors in the world.
Combien petit? Combien?
First of all, it is they interview patients so as to know in detail what their lives consist of. And the second most important thing is to go to the place where patients live in order to see the conditions they live in.
Este niño acudió a consulta, o sea, la mamá.
A mother brought in this boy to our hospital. He had a severe case of cholera. We treated him right away, and he recovered quite quickly. But our treatment doesn't just end with the boy. We have to go out to the area where he was from, interview the neighbors.
Bonsoir. Ici, Anthony Corinne, no?
Ah, sí. Mark Kelling avec
We need to find out how he got his cholera and if there are other conditions there that are going to cause the spread of this disease to other neighbors. We want to see where they go to the bathroom, where they eat. We want to see where they spend their time and where they get their drinking water from.
El agua de consumo del río, agua del río.
We find out everything we can from this area, so if there is an outbreak later on, we're already familiar with the residents.
Bonsoir.
We know what their names are, how many people live in each house, and we can attack the problem head on.
The most important thing, besides giving medical treatment to those suffering from cholera, is prevention, to prevent other cases of cholera in the area.
Yo comprimí cada liter. Identificamos que estos habitantes.
As a result of our visit today, we have found that the water that members of this community drink is the water they get from a nearby river, water that they don't boil, water that they don't treat at all in order to drink, and that might have been the reason for cholera in the child.
En esta ocasión, pues, le administramos tabletas de aguatar para...
So we have given them aquatabs, tablets, that give the water some chlorine in order to make it more potable.
Afortunadamente, no encontramos...
Fortunately, we have found no other cases of diarrhea, and we think that by means of the measures we are taking, we will be able to cut the transmission chain of the disease.
Al fondo podemos observar.
Here down this valley, we can see the river that surrounds the community of Basamblé.
El mismo que puede servir de fuente de contaminación.
This river can be a source of contamination for all the people living around this area.
Bueno, para esta zona de Basemblé, el río constituye...
The river is the lifeline for the community here. Since there is no potable water, they drink from it, wash in it, they clean their vegetables, they clean their homes with it, and in that sense, it is their lifeline.
Bien, los haitianos, ellos tienen una percepción diferente de...
Haitians have a very different perception of water. When they see it, it is very clear. They think it is safe to drink. And that is precisely how cholera spreads.
No solamente del cólera, sino...
And it is not just cholera alone, but also it spreads bacteria and parasites.
Está dentro de las enfermedades transmisibles.
As an epidemiologist in Haiti, we have a checklist of communicable diseases that we're always monitoring. These diseases spread very quickly and favor this sort of environment.
Son las infecciones respiratorias agudas.
On this high-risk list is tuberculosis, malaria, dengue, gastrointestinal infections, and also really high on our radar is upper respiratory disease.
También es una zona rural.
Most of the people here live in a rural area. They live in very remote places and have to do a lot of walking. They have to travel on foot. They have to make a lot of physical efforts, and that's also one of the causes of hernias in this rural area.
En primer lugar, porque aquí en toda esta zona,
in my personal opinion, so many Haitians suffer from hernias because they have got it during their childhood. Since there is no pediatric hospital around this immediate area, they have lived with the hernia. And then when the hernia is strangled and they have no other option, then they come in here and we have to operate on them. This is a 70-year-old. He suffered a hernia and had it most of his life, and it has never been treated. And it's a very simple outpatient surgery. The problem is that these people have gone so long without medical attention that when they do finally come in to see a doctor, we're always going to find something.
Este paciente, el doctor, el clínico.
The surgical operation that we carried out this morning on this patient saved his life.
Right now, we are heading to the hospital. Bonjour. And we are now carrying out the very first activity of the day, which is the change of shift. The team is supposed to carry out a ward round in the hospital. That's precisely what we're going to do right now.
When the hospital was first built in 2009, there were absolutely no medical services at all in this area. Women had no place to go and give birth, and people with problems that required surgery had no place to go. Cases with pathologies that required immediate intervention could not be attended to, and this led to one of the highest mortality rates. The closest hospital at the time was 3 hours away, and the cost was very high, whereas we provide free services.
My name is Dr. Emmanuel Mercius. I'm this hospital director. The Ministry have give us the human resource only. Thanks to Cubans, it help us with everything to have an hospital here. Money to clean the hospital, supplies, medication. The medicine in Cuba is so different. The difference is with the patient.
You know, in Haiti, people don't want to go to see a doctor. We heard about the Cuban doctor. They so good in examination. They so good to give people medicines to take. And then when we came here, they gave us some good attention.
There are American, French, Asian doctors in other hospitals, but I wanted to know, where are all the Cubans? The Cubans are very kind in how they treat a patient. When I came here, I thought I was dying, but I'm alive. I feel so much better.
Gendule, mama. Usanti dule. Sometimes, and almost all the time, they used to come here just too late. They don't do any follow of the pregnancy, so here we have to do our best. My name is Efrain Cosio, and I'm a family doctor. Normal cases here for pregnant women, they don't take pills, they don't take vitamins. Right now, she's not ready. We can deliver the baby tomorrow or maybe Sunday. I am from Bolivia, and I know how is the medicine in capital countries. Cuba has a different conception from that, so In the beginning, I was like, how could a country give everything for free? After continuing my studies, I understand the reason. They are very humanitarians, and they do their best in every country they go. So that made me change the way I see the medicine now. I came to Haiti 1 year ago. So my first impression here was like, what is the problem with this country? I have been in a lot of countries in South America, but I have never seen a country like Haiti. It's very painful to see that situation they are living. I see 20 children every day. At least 50 children has anemia. They have respiratory disease. Hernia, it's very common here too. I had been in shock the first day I arrived in Haiti. It was very shocking for me.
My husband is in Cuba. I've been married for 18 years, and I also have 2 daughters. One is 4 years old and one is 15. It's a huge sacrifice to be here and be so far away from our own family and our own children. But on the other hand, when you hold a child that appears dead and you bring him back to life, and when you heal somebody, all of that makes the sacrifice all the more meaningful and the work all the more rewarding. Come on in and see how the brigade lives.
Buenos días. ¿Cómo ha pasado el día hoy? Bien. Esta es nuestra pequeña vivienda.
Ensalada mixta y carne de res en salsa.
This is a typical, a very human dish. We eat it practically every day.
It's very interesting. We have shifts. We have shifts for cooking, for cleaning, for carrying the water.
In the same way she helps me in surgery, she helps me here doing dishes.
We were strangers. We didn't know each other before we came here to Haiti, but since we've been living here in this house together, it's like we're a real family.
It's normal for us to have some fight, to be disagreed, to argue, but in the end, we have one each other.
And we have to live together in solidarity because in the end, we're our own support network. We keep ourselves sane. This is a crazy country and it's hard to keep that sanity.
Bueno, las clínicas móviles son las actividades que realizamos los sábados.
On Saturdays, with our mobile clinic, we try to reach remote areas.
In the morning, I start at 5 o'clock, and I send 2 guys, and they go to announce the population about what will be going on. So when the patient comes, so they sit on the waiting place, and they pick numbers, start by 1 to the last number, so they can be in order. Some of them can walk like 2 hours from the mountain.